Good afternoon and happy Saturday. This is Nurse Eunice with Florida Training Academy. And in today's video, we're going to be discussing C. diff infections and what every caregiver should know. We'll give you about 10 seconds to receive your notifications, and we will get started shortly. Welcome, everybody. So the audience for this video would be family caregivers, CNAs, and also nursing students. All right, so what is Clostridium difficile or C. diff? It is a bacterium causing severe diarrhea and colitis or inflammation of the colon, associated with overuse of antibiotics, leading to disruption of the normal intestinal flora. It's highly contagious and can be spread through pores. Hi, Karen. The risk factors for C. diff infection include prolonged antibiotic use, especially broad spectrum antibiotics, hospitalizations or residing in long term care facilities, age over 65, weakened immune system, or previous C. diff infections. Symptoms for C. diff include frequent watery diarrhea, abdominal cramping and pain, fever and nausea, loss of appetite, dehydration from fluid loss. Good afternoon, everybody. I see you coming in. All right, so some of the symptoms that we want to review again, in addition to what we just discussed, is that your patients may complain of stomach tenderness. As we stated before, severe cramping because their stomach doesn't feel good. They can have a loss of appetite. With severe C. diff infections, there could possibly be blood in the stool. Because of the loss of fluids or dehydration, there could be a rapid heart rate. It can also be as severe as to cause kidney failure, weight loss, dehydration, and because the stomach is upset, bloating, and also due to infection, fever. So, how do we diagnose C. diff? At the bedside, we can collect stool. So, stool test detects C. diff toxins or the bacteria. The stool is commonly like a fudge like consistency initially. So it has like fluffy pieces with like rugged edges, and then it can progress to the watery diarrhea. So there are different stages of the C. diff infection. What's the treatment? Antibiotics such as I can't pronounce it, vancomycin, and also probiotics. And then if it's really severe, we can have a fecal microbiota transplant or a FMT. Infection control measures, hand hygiene. That is the first and most significant way to reduce the spread of C. diff. The C. diff spore is encapsulated. So if you use hand sanitizer cannot penetrate the spore. So hand sanitizer is not usually used on patients or in the care of patients who have C. diff infections. We must wash our hands with soap and water. Again, alcohol-based hand sanitizers are ineffective. We have to have the proper personal protective equipment or PPE. Normally, it's going to be gloves and gowns. We wouldn't need a mask as C. diff is not airborne. Patients with diagnoses of C. diff require contact isolation, so they should be in a private room. And then, as far as the environmental cleaning, bleach-based disinfectants are used. How do we prevent the C. diff infection? Judicious or careful use of antibiotics, strict adherence to hand hygiene, proper cleaning and disinfecting of patient rooms and equipment, and education of healthcare workers and patients on prevention. And so in this image in the far left corner, we have a healthcare worker who has poor hand hygiene. He infected a patient. This patient went to rehab, who infected more patients and staff members. The patient became sicker, ended up being hospitalized. And then, whenever the patient went to the doctor's office, because the patient wasn't taught the proper hand hygiene and how to prevent the spread of C. diff, he passed the C. diff to the doctors and the staff at the doctor's office. So not only is you being aware of C. diff and how it's transferred important, but you also have to let your family members and their caregivers know too. And so, where can C. diff hide? I love this image. And so, it can hide on uniforms, which is why nothing is supposed to touch your uniform. When you're making a bed, keep your legs away from the bed. When you're touching linens, nothing should be touching you because you could get this bug on you and transfer it to another patient. Look at the computer surface, look at the phone surface. If you have contaminated hands and you go into your pocket, your phone is going to be contaminated also. Don't forget about those long fingernails. Remember, in healthcare settings, your fingernails should not be longer than the tips of your fingers because the germs hide beneath those fingernails. And of course, we're not supposed to use polish because red or dark polish would allow bacteria to hide and to grow, and you won't be able to see it if your nails are dirty. So just provide good hand hygiene and overall care to your patients to decrease the spread of C. diff. And then those many surfaces that we touch, usually you'll see environmental services come back with the bleach solution, the cleaner to clean those surfaces. But we need to help them prevent the spread of C. diff. So, what is the role of CNAs and nursing students in C. diff care? You're going to provide diligent perinatal care to prevent skin breakdown. You're going to monitor intake and output, or INO, to assess dehydration. You're going to report any changes in bowel movements or patient condition properly. And you're going to ensure that infection control measures are followed. Before we get to our text, let's discuss some of the key takeaways. C. diff is highly contagious and requires strict infection control measures. Early recognition and reporting of symptoms are crucial. So you as the CNA, you as the caregiver, you're going to notice something before the nurse notices it. When you're assisting a patient to the bathroom, they're complaining of severe stomach pains, and they have watery diarrhea that has a foul smell, that is a huge clue that this patient may have C. diff. So once you have this clue, what do? You're going to make sure you wash your hands and clean any surfaces, and you're going to go out and report what you found to the nurse. So CNAs and nursing students play an important role in patient care and infection prevention. All right, and so I know a lot of you all have been adding comments to the chat, so I'm going to review them now. And so, hello, Mr. Tyshawn, first time for Colorado. I see Anna Kay, I see Car, I see Karen, and Tayos. I probably mispronounced that, but hello. All right, so question number 1. Which of the following patients is at the highest risk of developing C. diff infection? Is it A, a 35-year-old with a common cold? B, a 45-year-old post-surgical patient on broad-spectrum antibiotics? C, a 60-year-old with hypertension? Or D, a 25-year-old with a sprained ankle? And we'll reveal the answer in 5 seconds. So if you chose B, a 45-year-old post-surgical patient on broad-spectrum antibiotics, you're absolutely correct. As you recall, broad-spectrum antibiotics disrupt normal gut flora. So we have good germs and we have bad germs. The goal is to keep the good germs and to get rid of the stuff we don't need. So whenever we kill everything, we kill all of the bacteria with the antibiotic, it allows the C. diff to grow, and it puts the person at risk of having C. diff infections. All right, let's see how we do for question number 2. Which of the following is not a typical symptom of C. diff infection? A, watery diarrhea, B, nausea, C, chest pain, or D, abdominal cramping? We'll be revealing the answer in 3, 2, and Catherine has it. I see Catherine and Ann. Great job. It is chest pain. Chest pain is not typically associated with C. diff. However, watery diarrhea and cramping are more common. What is the most effective way to prevent the spread of C. diff spores? A, using alcohol based hand sanitizer. B, drinking plenty of fluids. C, wearing a surgical mask. Or D, washing hands with soap and water. And I know every one of you will get this answer correct. So we'll reveal the answer in 5 seconds. Anna K, Catherine, you all are absolutely correct. The correct response is D, washing hands with soap and water. So, soap and water effectively removes the C. diff spores while alcohol based sanitizers do not. Which type of isolation is recommended for patients with C. diff infection? Is it droplet precautions, fecal precautions, contact precautions, or standard precautions? Ooh, this one's tricky. What do you think, team? Revealing the answer in 3, 2, and I see Erica and Catherine and Janine and Susie. I couldn't trick any of you. It is C, it is contact precautions, including gloves and a gown are necessary to prevent the spread of C. diff. Remember, standard precautions are that you treat every patient as if their bodily fluids are infectious and you wash your hands. So in the case of C. diff, standard precautions are not enough. It's going to be contact precautions, which also would include contact isolation. They should be in a private room. Which cleaning agent is most effective in killing C. diff spores on surfaces? Is it A, alcohol, B, hydrogen peroxide, C, bleach, or D, vinegar? And this one is super easy. So we'll reveal the answer in 3, 2, and that is correct. Bleach-based disinfectants are effective in killing C. diff spores on surfaces. So notice how it says bleach-based. Because of the smell of bleach, some patients may have respiratory conditions, so we can't have really strong chemical smells in the facilities. So even though the wipes may have bleach in them, the facility will not smell like bleach. So that's why you don't have the bleach smell, but we still have the cleaning effect of the bleach in our facilities. How is C. diff primarily spread? Is it A, by coughing or sneezing, B, by blood, C, through the air, or D, by direct contact with contaminated surfaces or feces? And I know you are super smart and super awesome. So you all chose D, by direct contact with contaminated surface or feces. Don't forget that whenever you are cleaning somebody, you don't put those soiled items on the floor. If you put them on the floor, that means the next caregiver is walking through the residue and they can get C. diff on their shoes and take that throughout the entire facility. So everything that you do matters to help keep not only the patients, but you, other patients, and the entire facility C. diff and germ free. Which of the following is a common complication of C. diff infection? So common. Is it A, kidney stones, B, dehydration, C, high blood pressure, or D, stroke? And for this one, we'll reveal the correct response in 5 seconds. So 4, 3, 2, and I see everyone has it. I see new names. Hello, Laleen. Yes, LT. So everybody, it is B, dehydration. So severe diarrhea can lead to significant fluid loss causing dehydration. And don't forget, when your elderly patients get dehydrated, they start having other issues like tachycardia. Their heart rate speeds up. They can start getting confused. So we have to make sure we're monitoring their intake and output, and notify the nurse if there are any changes. Which antibiotic is commonly used to treat C. diff infections? Is it vancomycin, amoxicillin, erythromycin, or ciprofloxacin? And for this one, I'll give you 5 seconds because on the slide that discussed the antibiotics, I went through that one kind of quickly and I apologize. But as a CNA, you won't be given medications quite yet until you finish nursing school. So for this one, if you chose vancomycin, you are correct. Whenever I think of vanco, I think of like gorillacillin. It's like it's a stronger antibiotic. So vancomycin is one of the first line treatments for C. diff infections. What is the primary role of CNAs in managing patients with C. diff? Is it A, administering antibiotics, B, providing personal care and monitoring fluid status, C, performing diagnostic tests, or D, prescribing medications? Know your role as a CNA. What is your job when your patient has C. diff? And I'm doing my nurse dance over here. You all are correct. Oh, you know what, Anna Kay, you're not wrong because you all do the bedside test, or at least you collect the specimen. So I will give you a bonus point for C, but the correct response is B, because if we're just collecting a specimen and we're not providing personal care, if we're letting them lay in their fecal matter for too long, not only would they have C. diff in their diarrhea or their stool, they'll also end up having a urinary tract infection. And whenever we get a sample of their urine could have C. diff in it also. So the priority is going to be cleaning them and making sure that their fluid status is balanced. So CNAs play a critical role in assisting with personal care, maintaining skin integrity, and monitoring intake and output. And yes, you also collect the specimens. All right, question 10. Which of the following should be reported immediately when caring for a patient with C. diff? Is it A, mild thirst, B, decreased skin turgor, C, slight fatigue, or D, decreased urine output? Oh no, Mrs. or Mr. Thompson, that's okay. This next time, all you have to do is go back and take that written test, and you're going to pass and you're going to be successful. And we're not going to doubt ourselves because we know this. So I hope to hear from you in the future saying that you passed that test with flying colors, less nerves, and more preparation. All right, so for you all, number 10, the correct response is D. Yes, so let's go back so that you understand the differences between D and B. Whenever someone is dehydrated, we expect for them to have decreased skin turgor. So that's not something that you will immediately report to the nurse because she understands the patient has C. diff, they have diarrhea, they're going to be dehydrated until those IV fluids are started. So we expect some decrease in the skin turgor. What we don't expect is decreased urine output because decreased urine output would indicate severe dehydration and probably kidney failure. So that would be a medical emergency. All right, so what is the best way to handle contaminated linens from a patient with C. diff? A, shake the linens before washing them. B, place the linens in a biohazard bag. C, wash the linens with regular laundry. D, disinfect the linens before washing. So what do we do? And this one's tricky. I don't like this question. So I'll accept one or one of two of the four. And let's see what the response is. Place the linens in a biohazard bag. Contaminated linen should be placed in biohazard bags to prevent the spore spread. Now, in some facilities, this may not be the case. So in some facilities, you're just going to put it in the regular laundry bag. So follow your facility protocol. Or if you're not sure, ask the nurse, hey, I'm changing the linens. This patient has C. diff. In the facilities that I've worked at, they have a special supply closet for patients who are on isolation. So you had your normal patient dirty closet, and then you had your isolation patient dirty closet. And so that could be the difference. If your facility isn't using biohazard bags to transport dirty laundry, maybe they have a separate storage area to prevent the normally soiled laundry from being washed with the laundry infected with C. diff, because don't forget the C. diff laundry has to be cleaned with a bleach solution. Question 12. Which of the following is the most common trigger for C. diff infections? Is it A, overuse of hand sanitizer, B, use of antibiotics infrequently, C, overuse of antibiotics, or D, viral infections? And I appreciate you all for spending time with me on Saturday. I look forward to getting on here and just helping you all learn, because I like knowledge. I like learning new things, or I just like to, see if what I know, if I retained it. So the fact that you're here on a Saturday, I appreciate you all. And for this question number 12, if you chose C, you are correct. So it's the overuse of antibiotics that kills off helpful bacteria in the gut, which normally keeps C. diff bacteria in check. Remember, normally we have good bacteria, we have bad bacteria. When you kill off all of the bacteria just indiscriminately, you're going to allow the C. diff bacteria to grow. So without these protective bacteria, C. diff can grow rapidly, causing infection and inflammation. Additionally, C. diff forms tough spores that survive antibiotics, increasing the risk of infection and making them harder to treat. No, Mr. or Mrs. Thompson, I don't have an email address because I don't do the one-on-one, but we have so many videos in our library on YouTube that go through terminology. We also have free resources on our website, which is shown on each of the slides. It's fltraining.com. You all, I love you all, but I can't be your personal tutors. That's what you all have your teachers for locally, okay? All right, so question 13. What is the most reliable method for diagnosing C. diff infection? Is it A, stool samples testing for toxins, B, blood test, C, chest x-rays, or D, urine analysis? And this one is so easy. I know everyone's going to get this one right. So I'm revealing the answer in 3 seconds. And that response is A, stool sample testing for toxins. That's when you get the scoop, you get the tongue depressor, you get the specimen cup, and you go in and you scrape. You scrape it off the bed, you scrape it from the diaper, you scrape it from the collection device that would be in the toilet, wherever you can get that specimen from. You scrape it, you put a sufficient sample in a cup, you seal the cup up. We have this wrap that, like a cellophane wrap, that we put around the specimen container so they don't leak. In some facilities, you would have to, of course, you're going to put it in a specimen bag. In some facilities, you can't put stool in a tube system. So that would be something that would have to be hand delivered to the lab. If you're in a facility that doesn't have a lab in-house, well, then it will have to be mailed off to the appropriate laboratory facility. All right, question 14. Which of the following foods should be encouraged for a patient recovering from C. diff? All right, so Miss Nancy had bloating, severe diarrhea, she had pain, she went through being dehydrated, and now she is recovering. What food should she be eating? Is it A, high fiber diet, B, bland, low fat foods, C, spicy foods, or D, fatty, greasy foods? I don't care how much she wants some spicy chicken from Popeyes. If she eats that spicy chicken after having a C. diff infection, she is going to regret it. So the correct response is going to be B, everybody. It's going to be a bland, low-fat diet. We like to call it the rice diet. So we're going to start off, the brat diet. So we're going to start off with bananas. Then she can have maybe some rice, apples, and toast. So the brat diet would be low fat, it would be bland, and it would be less likely to cause stomach irritation. All right, question number 15. What is the key reason for placing a patient with C. diff in a private room? A, to give them peace and quiet. B, to provide better privacy. C, to monitor their condition more closely. Or D, to prevent the spread of infection. And that is right. You are absolutely correct. We can't have her in the room with somebody else, somebody who may have cancer, somebody who may have pneumonia, because we know that they are immunocompromised. They're already having other types of medical conditions, and we don't want to worsen that by putting them in the room with somebody who has C. diff. So the correct response is D. C. diff is highly contagious, so isolating the patient prevents the spread of infection. Question 16. What is a critical task for CNAs when caring for patients with C. diff? Is it A, teaching medication administration, B, writing prescriptions, C, monitoring skin integrity, or D, performing surgical procedures? I know how much you all want to do D, but of course that is not within your scope of practice. So, what is the correct response? And for everybody who put C, you are absolutely correct. You're going to be monitoring the skin integrity. So, CNA should monitor skin integrity as frequent diarrhea increases the risk of skin breakdown. Question 17. Which of the following patient outcomes would indicate effective treatment of C. diff? Is it A, resolved diarrhea and improved hydration, B, persistent diarrhea, C, continued abdominal pain, or D, increased nausea? So this patient's been in the hospital for 4 days. She is ready to go home. How will we know when it's time to retest her stool to see if the C. diff infection has improved? And if you chose A, you are correct. A. All right, so resolution of symptoms, including diarrhea and dehydration, indicates effective treatment. This patient's on the road to recovery and will be heading home soon. Question 18. Which of the following interventions is essential to preventing C. diff infection in healthcare settings? Is it A, routine colonoscopy screening, B, providing all patients with probiotics, C, careful use of antibiotics, or D, encouraging patients to fast? And the C, welcome. I'm glad to have you also. So, team, we're taking care of a patient. We want to prevent the spread in our hospital, in our nursing home, in our daycare center. What should we be doing? That is right. And if you're that authority figure, if you're that nurse, if you're that parent, if you're that patient, use your antibiotics as prescribed. So it's going to be C, careful use of antibiotics. Limiting the use of antibiotics help maintain healthy gut flora and prevent C. diff infection. So a lot of people get so mad at their doctors because they call their doctor and say, hey, I have a sinus infection. And because I have a sinus infection, I demand antibiotics. And their doctor's like, nope. Well, this is why they say no, because they know that we create superbugs by just giving everybody antibiotics and not allowing them to boost their immune system or use natural or home remedies first. So if your doctor tells you no, that is why, because they have to be careful with how they prescribe antibiotics. All right, so question 19. I didn't tell you this, so let's see if you can get it. How long can C. diff spore survive on surfaces? Is it A, a few hours, B, several days, C, weeks to months, or D, a few minutes? I didn't tell you that one, sorry. But let me tell you, they have to use a bleach-based solution for a reason. So, how long do you think those spores that are hard to kill, how long do you think they can survive without bleach? All right, so I'm going to say Ahamani said C or B. I have a lot of C's. I have a lot of B's. I have a D, so I do apologize. I did not properly prepare you, but the correct response is C, weeks to months, you all. Those C. diff spores are resistant and can survive on surfaces for long periods, making proper cleaning essential. All right, so question 20. What role do probiotics play in the management of C. diff? A, they cure the infection. B, they help restore healthy gut bacteria. C, they kill C. diff spores. Or D, they prevent dehydration. And for this one, we'll reveal the responses, the correct response in 5 seconds. Four, three, two, and everybody got it right. Woo-hoo! It is B. They help restore healthy gut bacteria. So probiotics are used to promote the growth of healthy bacteria in the gut during and after antibiotic treatment. And some of your yogurts have probiotics in it, just FYI. Okay, so which of the following is a sign that a patient with C. diff may need further medical intervention? A, mild abdominal cramping. B, diarrhea that lasts for 3 days. And notice the question said further medical intervention. So they've already been seen. C, increased appetite. Or D, high fever and severe dehydration. So this person needs further medical intervention. What do you think the response is? Oh, you are all over the alphabet. I see a D, I see a B, I see a A, I see a B. All right, so if a person has C. diff, they will have diarrhea, they will have abdominal cramping, and they will not have an increased appetite. So, if someone needs to seek further medical treatment, it is going to be because their symptoms have worsened. And so, which one of these would be the worst case scenario with the diagnosis of C. diff? Revealing the answer in three, two, and I know Catherine has it. Looks like Erica has it. If you all chose D, high fever and severe dehydration, you understand that those were worsening signs of infection. That means the person probably has colitis. It is bad, inflammation, bloating. Now they have a fever. They need to be seen by a doctor, probably need to be hospitalized ASAP. And they're also going to need IV fluids. So this would be the severe extreme case of C. diff. We understand that with C. diff, a person can have watery stools for a few days. So 3 days of diarrhea is not uncommon. All right, so what is the main benefit of fecal microbiota transplant, FMT, for recurrent C. diff infections? So grandma at least 3 to 4 times a year has C. diff infections. Why would we consider an FMT? Is it A, it prevents the need for surgery? B, it restores healthy gut bacteria? C, it increases appetite? Or D, it reduces the needs for antibiotics? Hey, Shadima. I can't pronounce your name, but hey. All right, everybody, revealing the answer in three, two, and you got it right. It is B. It restores healthy gut bacteria. So FMT introduces healthy bacteria to the gut to combat recurrent C. diff infections. All right, so this one is you. You are the caregiver. So a CNA was exposed to C. diff, and they plan to return to work. What is the best initial action the CNA should take? A, wash hands with hand sanitizer after every patient contact. B, wash their personal belongings with their kids' clothing. C, notify their supervisor and follow infection control guidelines. D, wear regular gloves and continue with patient care as usual. Look, I know you want to get back to work. You feel better, but just because you feel better doesn't mean that you are not still infectious. So, what is the best response for a CNA who contracted C. diff and now feels better and wants to return to work, taking care of sick patients? Hamani, you got it right. It is C, everybody. Look, you all, you need to talk to your supervisor. We don't trust y'all. You're going to notify your supervisor and then follow infection control guidelines. So CNAs exposed to C. diff should inform their supervisor and adhere to those infection control policies. Remember the PPE, etc. And it wouldn't be hand sanitizer. It's going to be hand washing before and after patient care to prevent the potential spread. Notifying the supervisor ensures that appropriate precautions have been taken. Look, they're going to be checking your temperature. They're going to be watching you like a hawk just to make sure that, and seeing how many times you're going to the bathroom, just to make sure that you really are no longer, that you no longer have symptoms from your C. diff infection. All right, question number 24. What is a common symptom indicating a severe case of C. diff? Is it A, bloody stools, B, slight fatigue, C, normal bowel movements, or D, frequent urination? Severe case of C. diff. And for this one, we'll reveal the answer in 5 seconds. 4, 3, 2, get them in, get them in, get them in. Yes, Catherine, Erica, Core, Ahamani, Shindinama. All right, you all got it right. It is A, bloody stools. Bloody stools are a sign of a severe C. diff infection requiring immediate medical attention. Our last question. It's almost time for us to go. I hate this moment. Question 25. What is the first step CNA should take after coming into contact with a patient with C. diff? Is it A, use hand sanitizer, B, wash hands with soap and water, C, put on a mask, or D, take a break? That one was extremely easy. That's right. I know that you all are going to have short nails that don't have any fingernail polish, nothing that is dark red, right? It needs to look natural. And that you're also going to be washing your hands with soap and water, B, before and after patient care, because we know that those spores cannot be killed by hand sanitizer alone. Guess what, team? We did it on a Saturday at noon. We did our video. Woo-hoo! Now, Paja, stop spamming. All right, I gotta block whoever that is who put their WhatsApp information. We don't do that here. All right, so you all don't forget to like the video, comment, share, let others know about our channel and how through our many lessons in our practice test, we help CNAs and nursing students from around the world pass their exams. Only the first attempt, sometimes the second, but unfortunately, we don't have a regular schedule because we have a full-time business operating here in Jacksonville, Florida. Well, we have students in person, but I always try to make it my business to get on here twice a week. Plus, we have other people helping. Next week, you get to meet one of my favorite nurse buddies, Shane, Dr. Shane. He's going to be on talking about men's health. We're also going to have Jennifer from Senior Helpers talking about what makes a great home health aide, a CNA, a companion for home health care. So you all are going to have 2 leaders in the medical community who are going to join me online so that we can learn and ask questions. And of course, I'm going to stay around for a few moments to see what questions you have for me right now. You're going to pass next time. I know you're going to pass. All right. So, we'll give you about a minute. Anybody have questions? And don't forget, if you go to our website, fltraining.com, click on resources. I got so many free study guides. You all just have at it. So from terminology to vital signs, to CPR, to the nurse courses. And then there are also some materials, some bundles that only cost $5. And we have playlists on YouTube. So if you need to learn how to do skills, if you need to just review terminology, just type Florida Training Academy and whatever it is you're looking for. And more than likely, it's going to be there. Okay, if you all don't have any questions, I'm about to go enjoy my weekend. Bye, everybody. See you next time.